Persons living with sickle cell disease are at a higher risk of getting infected with COVID-19 and more likely to get severe illness if they get infected. This is due to their impaired immunity resulting from their blood disorder. People living with sickle cell disease should therefore strictly observe the precautionary preventive measures for COVID-19. During this period of coronavirus pandemic, persons living with sickle cell disease are advised to ensure that they keep a minimum of 1 month supply of medication at all times. In addition, they should consult their healthcare providers should they experience COVID-19 symptoms. At least 240,000 children in Africa are born each year with sickle cell disease. Here in Kenya, it is estimated that 6,000 children are born with the disease. Sadly, between 50 to 80% of these children die before their 5th birthday. We have 117 people who have tested positive for coronavirus disease over the past 24 hours from a sample size of 3,043. The new positive cases pushes now our confirmed cases to 4,374. The total tests carried out so far are 133,541. Of these 117 positive cases being reported today, 112 are Kenyans and 5 are foreigners. The age ranges from 11 years to 75 years. 83 are males, 54 are females. In terms of distribution by county, these 117 are distributed as follows. Nairobi 51 cases, Mombasa 22, Kajiado 18, Kiambu 6, Nakuru 5, Garissa 5, Machakos 3, Kericho, Busia and Uasin Gishu 2 cases each, and Wajir 1 case. Below the counties at the sub-county level, we look at Nairobi. The 52 cases come from Kibra 8, Langata 8, Makadara 6, Dagoretti North 6, Kamkunji 4, Embakasi East 4, Embakasi North 3, Embakasi South 3, Mathare 2, Ruaraka 2, Embakasi Central 2, Embakasi West, Starehe and Kasarani 1 case each. Mombasa's 22 cases come from Mvita 8, Kisauni 5, Changamwe 4, Likoni 3, Jomvu and Nyali 1 case each. In Kajiado, the 18 cases recorded are from Loitoktok 12, Kajiado Central and Kajiado East 2 cases each, Kajiado North and Kajiado West 1 case each. In Kiambu, the 6 cases are from Thika 3, Kiambu Town, Limuru and Lari 1 case each. In Nakuru, all 5 cases reported are from Naivasha. And in Garissa, the 5 cases in Garissa are from Dadaab refugee camp. In Machakos, the 3 cases are from Athi River. In Kericho, the 2 cases are from Ainamoi, while in Busia, the 2 cases are from Teso North and Matayos. In Uasin Gishu, the 2 cases are from Kapseret and Soy. while the one case in Wajir is from Wajir West. I'm also pleased to inform you that we have discharged 91 patients from our various hospitals, bringing the total number of recoveries to 1,550. I want once again to thank our healthcare workers for the excellent work that they are doing out there. However, on a sad note, unfortunately, we have lost 2 patients to the disease, bringing the total fatality to 119. We send our deepest condolences to the family and friends of the departed. Finally, as you can see clearly from the numbers above, the spread of the virus is concentrated in some areas. Some areas, especially within the epicenters of these 2 large metropolitan urban and peri-urban areas of Nairobi and Mombasa. This could be attributed to change in behavior in some of these areas. For instance, we are aware that in certain parts of the city here, especially in some of the suburbs, such as Westlands, Lavington, Kileleshwa, and Hurlingham, we are seeing increasing number of young people congregating in groups and organizing gatherings such as house parties in some of these areas. We caution that this is recipe for disaster, because that is when the virus is spread, when people get together and do not take the necessary measures and cautions that we have been preaching out here. This could well be some of the reasons why we begin to see increasing numbers in some of these areas. And again, we want to appeal to these young people and any others who may be flouting the rules, the regulations that have been put in place, not observing the containment measures, that we will stand the risk of igniting the spread of this virus in these regions.
This is just to warn the young people that they are not immune, one, from contracting COVID, and in the unfortunate case that you get a serious form of COVID-19 disease, that if you are young, you are not immune to death. We know now the Premier League again has resumed, though in empty stadia. Kenyans love football and soccer, and my appeal to the young people is that even if you are to watch the game, please ensure that you have your mask on and you maintain the physical distancing so that you don't put yourself at risk. Deaths now, we are seeing, even yesterday we reported a case of a death without any underlying medical condition. So as the numbers increase, significantly we'll have more deaths, and these deaths now will not apply only to the high-risk group, but will stretch the entire age cohort. In terms of the people we had who are given as wrong contacts, again, remember we are working through the multi-agency team. And further now, when we are taking the details, we take the details of your passport number or ID number to ensure that we can be able to go back to our data to be able to find out where you are. Out of the initial 140, a few number from that group were also people from outside Kenya. And people gave various reasons, of course, once we caught up with them for giving wrong information. Remember that happened especially when we were doing the targeted testing in Isili. And because of the large community of refugees in Isili, some of them were fearing disclosing their real contacts, because then the security forces would be able to catch up with them. But all these 140 people have now been removed from our contact list after follow-up and after finishing the 10 plus 3 days without the symptoms. For contact tracing in State House like any other part of the country, of course, we do testing routinely, and if we get cases, We have had the support of officials of State House to ensure that we do contact tracing. And the number that was reported was from a very, very huge sample. And I want to commend State House staff for routinely testing after every 2 or 3 weeks all the staff within their premises. So contact tracing in State House, just like any other place, continues as usual. And we are getting total cooperation from our colleagues at State House. The nationalities of foreigners in the spirit of regional cooperation and integration. We have received an advisory from Ministry of Foreign Affairs that our neighboring countries are reluctant that we don't disclose the nationality of any person from their countries who is tested within the territory of Kenya.